Valerie, can you tell us about the training you have with Ethiopian women in the Afar Desert and actually what you're trying to achieve with them?
We're training traditional birth attendants. These are the ones who are actually delivering in the home, where 98% of mothers have their babies. And these women have only got their traditional information. What we're adding to them is just practical skills that come from the medical world that simply save a mother's life. We discovered that Afar are actually using 6 practices that actually could kill or injure the mother and or baby in the birthing process. So we help them to expose those traditions and then to see that they are illogical and wrong in the birthing practice and then stop it. The traditions are, yes, of course, female genital mutilation. That's number one, but that's not the only one. Aside from that, there is one called Cana, which is closing the mother after the birth. So you've cut her open along the female genital mutilation line. Now you're going to close her by roping her from the waist to the knees and tie those ropes really hard, and she will lie like that for 7 days until that part of the body seals over again. So that means she gets number 2 female genital mutilation. That's number 2. Number 3, during the labouring period, she's not allowed to eat or drink very much because the Afar traditionally think the bladder and the uterus join, and they say that if she eats or drinks, you tip the food and the water on top of the baby's head. And so the midwife will virtually dry up the mother in the birthing process. That's very dangerous. Number 4, when the baby's out and crying and the placenta's still in, they will cut that umbilical cord transverse along the cord, along the pulsating arteries, and bleed the mother as much as possible, because they say that any blood coming out is necessarily bad. And when they bleed her, she will extrangulate, she could die. But they will say that they did a good job and God took the mother. And so we teach them not to do that at all. And we teach them also the 5th one, to breastfeed immediately, to let the oxytocin leave the brain and close and make the uterus go smaller and push out that placenta. They will not traditionally breastfeed for 24, 36 or 72 hours after the birth, because they say the first milk, the colostrum, is dangerous in tradition. The last tradition which we ask them and show them that they should stop is that they will wash the baby, the mother and the midwife after the birth as kind of like a ritual washing. And then they will not allow the mother to touch water or drink water for 7 days. They will close the house and smoke the house. She lies inside sweating, dripping blood, dripping breast milk, smelling, going to get an infected wound between her legs and just feeling awful, itching like crazy, baby screaming. And it's a stinky, stinky house. And yeah, this is just all the reasons why mothers get infected and the newborn baby gets infected. And so we ask them to stop that, to ventilate the house, wash her with soap and water every single day, but to do the end ceremony, which is to kill a goat and then give part of the goat to the poor people, which is a traditional ceremony. Continue that ceremony, have a good time, have a good celebration, but do this cleaning and this washing in the meantime. Stopping those 6 traditions definitely saves mothers, and we've reduced a lot of maternal deaths that way.
And how do you reinforce the messages once you've done the training? How do you go back and check that they're actually putting them into practice?
In the first place, the traditional birth attendants are trained by people in our primary health team called women extension workers. These are women who are literate and have been trained in safe motherhood and trained how to train a traditional birth attendant. These women then monitor and mentor the TBAs, go with them and check them. And we put them in an agreement situation. If they're not going to leave these 6 traditions, we don't want them. So if the woman extension worker finds that after the training the traditional birth attendant is defiant and continues these harmful practices, then she tells her, no, you won't be coming to the next annual training, and we don't need you. We will not supply you with birthing kits. You will not be part of our organisation because you're continuing bad practice. We train the birth attendants every year so that their information they've received is reinforced and reinforced. And then through the training, we are able to listen to them, how they're able to implement what they've learnt, and we're asking them to what level they've stopped these 6 practices and how they've found it acceptable within the community to stop the 6 practices. And then we're giving them all the time just a little bit of extra information. We can't be too technical, but you can add on just one more thing, perhaps about bleeding after childbirth, perhaps about mother's nutrition, something else, and always emphasising to the traditional birth attendant what is the system and who should be referred. How you refer and who should be referred is always very clearly spelt out for them, because that's what we want. We want women who are at risk to be referred to a hospital, to a clinic before the delivery.
Can you tell us too about when you use your birthing sets, how you train the women to use the waste and what they do, for example, with the razor blade?
Right.
Comes with it.
With the birthing set, obviously we've got plastic there, we've got a razor blade, we've got things that have got to be thrown out, disposed of. What they do traditionally to dispose of the placenta is to dig a very deep pit that the hyena will not be able to reach the placenta or eat it. That's very important to them. So into this pit they throw things they're going to dispose of. We teach them, if they would like it, to keep the plastic sheet. And so that's got to be washed very well with soap, put in the sun to dry, and then it can be used as a plastic sheet for the mother in the post-birthing time when she's bleeding, or for the baby. They can keep that plastic sheet. The rest of the rubbish should be disposed of in that hole. With the razor blade, they can dispose of it in that deep hole. What we try to encourage them to do is return the dirty, and we give them a tin for this, return the dirty razor blade to the health worker, to the woman extension worker in their community, so they can get the next birthing set. So give a dirty one and get a whole new set.
And with the birth attendants, how do they feel after they've done the training? Are they empowered, or do they feel different or act differently?
Once a traditional birth attendant is trained, she will now say, yes, I've got new skills, because there's things about it that to her is magic. For example, if you breastfeed, the placenta falls out. They think that's a magic birth, and they will give it a new name, a different name. And so, yes, they feel, and they will talk about, we give them also equipment which makes them look different. They've got gloves to put on, they've got a bag to carry everything in, they've got a torch to help them with the work. And so, yeah, they're a different woman now. They're a woman who's talked about it. They've been in the discussion of stopping female genital mutilation, and they feel like talking to other people about it. So they are a different woman, totally different.
How far the training is extended throughout the Afar region?
At this time, our organisation has trained roughly 920 traditional birth attendants. We train more and more and more. We can afford that by paying for the training and the equipment, because we don't employ them. But we think it's utterly necessary, because there are, in fact, thousands of traditional birth attendants in Afar region. But what we are trying to do on the other side is empower and to push the families into only accepting a trained traditional birth attendant for the birthing process. So in each small level administration district, we like to have at least 4 traditional birth attendants that we've trained. And each year, as I say, we bring them back again for training again.
And can you tell us about the birthing sets that you make yourself?
The birthing sets we make ourselves, we buy the material locally. So we buy a huge roll of plastic, cut it up into sheets, and so there's an underlying sheet for the mother to deliver on, if you like, a clean work area, not sterile. Nothing is sterile. We put in that sheet of plastic, 2 cord ties, a new razor blade for cutting the baby's cord, and cotton wool, a gauze binder for the baby's umbilicus, and 2 torn up sheets. One is for drying the baby, the other one is for wrapping around the baby as soon as the baby is born to put the baby onto the breast. And that makes up the set, plus soap. And she also has nail cutters to keep her nails clean. Oh, I've forgotten, of course, gloves. Gloves are essential because we are teaching them to prevent HIV transmission as well as hepatitis transmission, which is transmitted through the blood. And so basically, she also has a bag, she has a torch, she has nail clippers, and she has a bottle where she makes fluid of boiled water and salt just to wash the mother between the legs.
So Valerie, can you tell us about the stopping of genital mutilation?
Female genital mutilation, firstly I want to say, is an ancient tradition. It's been going back for thousands of years. It probably links the Pharaoh of Egypt, that's how old it is. It is stopping, but we've only started the process of stopping in the last 10 years. It's stopping because the biggest strategy we're using is showing them that it is not in their religion. Afar are Muslims, and it is not in the teaching of Islam that you should mutilate the body of a female for the sake of her virginity or whatever. And we're teaching them that, plus the fact that it is so damaging to their health. It is retaining their urine. If you close off the vagina, you seal over the place where the urethra is, and so she can't drain out the urine properly. She drains it out in drips. She can't menstruate properly. The clot is staying inside the vagina. This is very, very damaging and causes kidney disease, causes vaginal infection. Many problems are happening to this woman. When they understand this, they are disgusted, in fact. And we've actually made a film about female genital mutilation, and in the film is a very short clip of it actually being done by a community who said to us in the first place, we like doing it. So we said, look, we're going to film it, and they said, welcome. But we then showed it to that community, and they all stopped immediately. They stopped in horror of the actual tradition. So what I'm trying to say, I think, is that it's stopping in the hands of Afar, through the Afar leadership, through the religious leadership, the clan leadership. It's stopping through women understanding that they're hurting their fellow sisters and so on, and that, it's not necessary. They do revert to a lesser form of it, which is called the Sunnah form, which is just to take part of the clitoris off. We believe slowly that they will even stop that. That is in process, and there are parts of our community where they don't do anything anymore. So this system to stop this particular harmful practice is rolling on, and the great thing about people who are firstly illiterate and then become literate is that they are very honest with themselves. They're not intellectually dishonest. So that once you start a dialogue or a discussion, they don't close it till they've got a solution.
Valerie, how do you know that the birthing kits and the birthing sets and the training have made a difference in Ethiopia?
We do know it's made a difference and making a difference because we keep record of everything. So we keep record of each delivery, and those are kept by the organisation. We keep records of antenatal checking, for example, and of treatment of pregnant women and delivering mothers. And these records are showing us that we are lowering the maternal death rate. And quite frankly, we're not doing it alone. I keep saying we, but we are doing it with the Birthing Kits Foundation Australia. We're doing it with them, and it's a partnership. It's really a partnership, and we're so thankful for this opening of this partnership, of being able to make the sets ourselves and also to train traditional birth attendants.